in a few. Excellent. So thank you everyone for joining us today, and welcome to our Child Bright Network webinar around strength-based healthcare leadership. This webinar is brought to you by the Child Bright Network Knowledge Mobilization Clinician Hub. Our speaker today is Erin van de Veen, who is the Associate Chief of Nursing Practice at the Hospital for Sick Children. Erin is an award-winning change leader who helps individuals, teams, and systems implement tools and leverage behaviors that elevate the nursing profession, improve patient safety, and enhance family-centered care. During the presentation, feel free to introduce yourself in the chat and also type your question in the chat as well. We'll answer your questions at the end of the webinar. It is now my pleasure to pass the mic to Erin.
Good morning, everyone, and thank you, Alex, for that introduction. I'm very happy to be here today to talk to you about strengths-based nursing and healthcare leadership. If you want to just give me a very brief technical pause so that I can cognitively make sure I'm doing the right thing at the time. I'm seeing that you can see my slides, but if that's not the case, please let me know and I'll keep an eye on the chat. I see a thumbs up. Thank you. Thanks, Alex. That's great. So my name is Erin. I go by the pronoun she, her. I am the Associate Chief of Nursing Practice here at the Hospital for Sick Children, which is where I am speaking to you from today. So let me tell you a little bit more about myself. You know, bios only get so far in the context of, you know, us getting to know each other and spending the next hour together. So I'm Erin. I'm a healthcare leader. I'm a nurse by background. I've been a nurse for 18 years. I'm also a mom. I'm a mom to 3 small boys. I also have a dog and a turtle. I'm married to my partner, Nick, who is a teacher. Shout out to all the teachers this week. It's a very busy week if you're a teacher. I'm also a commuter. I commute from Mississauga every day. I take the train. I love the train. Put a smiley face in the chat if you also take the train or you're a commuter. I am a book lover, which goes actually hand in hand with me being a commuter. I read many, many books each year, and I usually activate my commuter time for my book reading time. And if you have book recommendations, I'd also love to have those in the chat as well. Not only that, but I have a sweet tooth. Sometimes I put in my bio that I'm on the search for the world's perfect chocolate chip cookie. I'm aiming to taste test my way through as many chocolate chip cookies as I can in my life so that I will one day achieve my goal of finding that perfect cookie. Beyond that, and you might have already gotten that in the next, in the last like enthusiastic minutes that I've presented myself, I am what I call a chronically positive and self-reflective person. Chronic, it's a chronic issue for me, how positive I am. And here's some of the data that proves that statement to you. I'm what's known as an ENFP. I'm extroverted, intuitive, feeling, and prospecting individual. That's on the Myers-Briggs. In terms of my Clifton strengths, my #1 rated strength out of 34 possible choices is positivity. I'm also an activator, a strategic thinker. I love communicating, and I really love input. I love to grab inspiring things from wherever I can find them, and I'm sure we'll get a bit of that during today's presentation. I also am an Enneagram 3, which is known as the achiever, but also to me known as the cheerleader. I feel my best when I'm helping others do their best. And from the SDI core strengths are noted as being sociable, caring, and self-confident. So these are all things that you're going to put together in the package. I'm you know, hoping that you really get a sense of who I am and why I'm really enthusiastic about bringing the strengths-based nursing and healthcare leadership framework to everybody that I possibly can. Because of this chronic positivity that I have, I feel like it's a perfect match for the strengths-based nursing and healthcare leadership framework, and you're going to find out why. So what are you going to get from this session? Thank you for joining us today. I hear a couple of people pinging in. There's a lot of fun doorbells happening. And Alex, thank you for being my partner and bringing people into the room today. Here's what you're going to get from this session: a clear definition of the values in the strengths-based nursing and leadership values wheel. You're going to get an introduction to the spiraling process, which goes hand in hand with that wheel. We're going to do a fun application of the content to a children's story. I am, by all things, first and foremost, a pediatric nurse, and I really love to use easy, accessible content to help us think about these broader contexts, especially when our work, our day-to-day work, it's fun to work with kids, but it's also very, very, very difficult, and that can make it hard to apply concepts too, because the work is so challenging. We're going to go through a relevant case study for further application and to help you work out those concepts. And by the end of this session, you'll be able to think about your own lived experience and where the strengths-based nursing, healthcare, and leadership values can be helpful in your own practice. So let's dive in. This is strengths-based nursing and healthcare. And if you are working at Sick Kids, invariably at some point in your environment, you will pass a bookshelf that has this book on it, which is the strengths-based nursing care book. It's a textbook of some in some ways. Health and healing for person and family. Strengths-based nursing and healthcare framework was developed by Dr. Gottlieb in 2013 in collaboration with her husband and partner, Dr. Bruce Gottlieb. Strengths-based frameworks are about moving from a deficit-based model to a strengths-based model in everything that we do in healthcare. The Strengths-Based Nursing and Healthcare Leadership was founded as an institute in 2014. It is directed by the Gottliebs as well as Pam Hubley, who many at Sick Kids will know well, but Pam is presently the Vice President and Chief Nurse Executive at UHN. And the Institute also lives within McGill's University and their Faculty of Nursing over there. So here's essentially strengths-based nursing values on nursing and healthcare values on one page. Why would we use this framework in our practice? Okay, so the reasons are in the heart. So if you're looking for a why, we're going to find it on this slide here. Why we do this is because we need to move from deficit-based thinking to another way of looking at our problems. If anything we have learned in the last 4 years is that there is always going to be a plethora of issues to look at what is going wrong within the system at any given time. Even within the Child Bright Network, even with the best of our intentions as healthcare providers to improve healthcare for children and to improve access for those children to that healthcare so that those children can have positive futures and impact the entire world, even with such a lofty and beautiful vision, there are many, many ways to be bogged down by deficit-based thinking on a day-to-day basis. The goal of this, why we want to do this, is to motivate, empower, and engage all players within any given context, work environment, work problem, new project and situation. You want to motivate and empower everybody to feel engaged in collaboration. The framework also informs the approach that we take to our work as leaders. It has informed the approach that I take to my work as a leader since I was introduced to the framework in 2018. It comes up constantly every single day. When I have a tough day at work, invariably, it is because I have forgotten a lot of these principles and I have not used them in my leadership backpack on that particular day or particular week or particular month. This framework can be used in a variety of different ways. It can be used to help us describe an issue. It can be used to help us go a level deeper to build a solution. It can be used to help us gain and communicate an understanding to others who might not be involved. Eventually, again, I said I've been working with this framework since 2018. Eventually, strengths-based thinking becomes a way of thinking and being as a leader. It will manifest with your intentions with ease. And many of you will find as I go through the content, you're already practicing in this way. You might not just have had the vocabulary or the vernacular to apply to what you're doing when you're taking this approach in your work. What we value guides our actions. And this is something that seems really obvious as healthcare leaders. Obviously, if we came into this profession, what we value is helping people feel better from whatever place that they're meeting us at. And yet, sometimes our work gets more complicated and more nuanced than that. And we need to ask ourselves, what matters most in this specific situation? And if I were to honor and care for what matters most, what would I do next? So that's where we're going to use the wheel today to talk about what did we value and how did that show up in our actions? And how can we reframe things that are feeling really deficit-based into feeling more strengths-based as we move through our work to achieve our vision and our goals. Another really important part of the strengths-based nursing and healthcare leadership framework is the spiraling process. The spiraling process is a tool to engage in conversation, in discovery, in analysis. It starts with us exploring. We move from an exploring phase to zeroing in. When we zero in, we can work out with greater detail the situation that we're all trying to accomplish, and then we review after we've worked it out. This spiral is iterative. You can go from one level of the spiral to another. Sometimes, and many of you on the call will recognize this, you may have had a situation where you explored, you felt like you had a good sense of the information, you'd done an environmental scan, a needs assessment, you'd reviewed the literature, you brought that to your stakeholders, you started to zero in on a problem, and then you had someone with a new perspective that wasn't included in your exploration say, but I just think we're missing this, or I'm not sure we've considered that. And so the spiraling method is flexible because it allows us to cognitively remember we're not fixed on a linear pathway to solving a problem. We're in a spiral. We can go up and down as we solve that problem. And going up and down doesn't hold us back. It doesn't mean that we're delayed or that we're struggling or that we're never going to find a solution to the problem. The spiraling method is flexible and open to where discovery may lead. It also helps me as a leader manage my own expectations about where a conversation will go. I want you to put a hand up in the chat if you've ever been in a situation where you're like, here's my message, here's what I need to get consensus on, and then I'm going to wrap that up and go to my next meeting. You have really fixed expectations about what you need from very specific points of your day. And sometimes those conversations don't go as we planned. In fact, a lot of the time they don't go as we planned. And sometimes we leave our meetings feeling depleted because our expectations as leaders weren't met. We went in, we had really good intentions, we were really clear on our message, but perhaps we're actually just not getting where we thought we wanted to get. Instead of feeling depleted and deficit focused on those things not going well, we can use the spiraling method to say, I am in a process of uncovering and discovering strengths and validating that as I move my way through this problem, this issue, this initiative, this project, this policy, whatever it may be. All right, so we're going to spend a little bit of time on some didactic content. There is a QR code at the bottom, which will take you to a fulsome website. It's on the McGill page for strengths-based nursing and healthcare, which will give you a more fulsome, detailed description of the definitions of the values within the value wheel. If I move too quickly and you want me to go back to a value, please, by all means, just pop that in the chat and I will be able to toggle back and forth. We're going to just go clockwise through the values wheel, and I'm going to share the definition with you. So when we think about systems thinking as leaders, we're working within the whole while appreciating the many, many relationships among the parts of the system. You know, and if I think about my day today and the top of the things that are on my email inbox, most of them are related to systems thinking. Most of them are going to challenge or require me to deploy the value of systems thinking. I have to work within the whole while appreciating the many disparate relationships among the parts of the system and the ways those parts have relationships with me and my work, and those parts also have relationships with each other, have nothing to do with me. When we think about the value of systems thinking, we're deploying that appreciation for how complicated and nuanced our system is and the interconnectedness of relationships within it. The next value is uniqueness. So as leaders, we're looking for the uniqueness of our staff, our colleagues, our organization, our patient populations. This distinctness of those features will be a part of our response and our reaction to any change or issue. A lot of the times, and I gave you a really long list of who I am as an individual, what I think makes me particularly unique. A lot of the times we're carrying that around. We're carrying our own uniqueness around, and we're looking to deploy and leverage our uniqueness in whatever situations we're moving through. But leaders who function from a strengths-based perspective look for that in other people. They look for the uniqueness that other people are bringing to the table. These are values, they are not strengths. So that's an important distinction. When we're thinking from a strengths-based perspective, the sky is the limit. There is no list of official strengths. You can find them wherever you are looking. If you are looking for uniqueness, you might be looking for uniqueness of strengths, but you might also be looking for uniqueness of experience, uniqueness of point of view, uniqueness of training. The distinctness that each of us bring to our work will always be a part of how we respond. That backpack is something I'm going to bring whenever I respond to issues, but so are the people who I am working with, also bringing their own distinctness. If I understand as a leader what makes a person or a team unique, that will impact me and how I move through the work, and it will also impact many of the other things on the slide here. The next value is health and healing. This one seems kind of like an obvious one, but I'll be honest with you, sometimes as a leader, when I reflect on my work, I think this is the one that I skip the most often because we take it for granted that we are here because we want our patients to feel integrated and whole in their lives. But we don't always pay attention to the way we as individuals or others as individuals or teams are whole and integrated as well. And as a leader, the innate qualities of health and healing on a team might look like things like team wellness, the strength of our team relationships, the competence and capacity among our team, our ability to ebb and flow, and the experience levels, the varying experiencing levels across our team. I'm sure many of you on the call have had health human resource challenges in the last year. You've either been directly impacted by them, you've been trying to solve those challenges, you've been trying to be flexible to navigate those challenges. When we talk about recovering from the pandemic and recovering our human resource workforce, this is in many ways a health and healing. We value the health and robustness of our workforce. We recognize that that workforce was tremendously depleted by the pandemic. And that when we pay attention to things like staff wellness, staff relationships, staff engagement, staff capacity, staff training, we're doing so from the value of health and healing as a leader in healthcare. Multiple perspectives and creating meaning. That's in many ways what we're doing right now. We're acknowledging that our experience will shape our understanding because it will assign meaning to any given situation. You on the call are bringing your experience to the webinar today. You're going to interact with the content, you're going to interact with me, and you're going to begin to understand the content and assign it meaning based on whatever perspective you're bringing to the table today. Even today, again, I alluded to my email. I've got a couple of hot issues on my email this morning. They had me a little bit activated, a little bit stressed out. And if I think about that perspective, I'm also bringing that perspective to this content today. I'm kind of experiencing this content in a new way because I have real life problems that I need to be engaged in solving today. And so I'm bringing that as I share this content with you. And that's also iterative, right? Every time we interact with the content, we might be bringing a new perspective to that content. As leaders, we have to understand that our search for meaning requires us to be curious about facts. It requires us to acknowledge our own experience within a situation. That might be a lot of experience. That might be very new experience that we're building and growing. We also want to pay attention to our perceptions. We also want to, it's not on the slide, we want to pay attention to our biases, our attitudes and beliefs, and then we want to be able to knit that together to create meaning in a cohesive way with others that allow us to say, what is the problem we're trying to solve? Do we agree that that is the problem we're trying to solve? And what are the perspectives that we're bringing to that problem? And I said the problem word, what are the strengths that we're also seeing within that problem that we're experiencing together? Self-determination. Leaders respect a person's individual choice in a given matter, even when there may be limits on those choices. I like to think this is an obvious one. Is like, of course, we respect that our staff have autonomy. We respect that our teams have autonomy. We respect that our colleagues have autonomy. However, again, I talked about that going into a conversation, having a set expectation, having a set agenda, really thinking that you're going to go ahead and deliver. And then the autonomy and self-determination of other people in that context starts to kind of, make you feel like perhaps you're not the only one who's got a voice. You're not the only one who's got something to say. As a leader, when we value self-determination, we reflect that most often our role is not to decide for other people, is not to decide for our patients. It is to clarify, elaborate, explain, and provide information while also sharing resources, correcting misinformation, and advocating and amplifying the voices of others. Self-determination and multiple perspectives and creating meaning actually go very, very well hand in hand. Because as a leader, you recognize that in order to create multiple perspectives, you also have to advocate and amplify others, recognizing their self-determination to come to the table, their choice in the matter to engage with a particular problem or particular solution. Goodness of fit. Goodness of fit was a hot topic during our health human resource challenges. We understand as leaders that how we are as individuals and how the people we work with are affected by the physical and social environment of a culture or a space. When there is a good fit, the environment, and that could be a physical environment, a virtual environment, a synchronous environment, an asynchronous environment, where there is a good fit, the environment can facilitate people to draw on their strengths or provide opportunities for growth and development. What we found after the pandemic is that workforce was so depleted, we had to do a lot of work with the value of health and healing while recognizing that the physical and social environment and the culture of the space had transformed so radically that many people, many of our colleagues, people we care about, people we worked with for years, felt like there was no longer a good fit between them and either the organization, and for many of them, there was no longer a fit between them and their health profession. Timing, readiness, and learning. So as a leader, learning is key to navigating change. And actually, timing, readiness, and learning plays into your participation in this webinar right now. Your readiness to engage with the content is a prerequisite for your ability to hear what I'm saying and be willing to learn. In a lot of ways, the Zoom invite is a very good example of this. So your readiness to engage with the content requires you to register and sign up. The timing on the given day of the webinar needs to be right for you to sync that registration with your actual participation in the webinar today. And then your learning will follow from that to enable you to interact with the content and to engage with your strengths and to be able to maybe think about where you want to apply the content and perhaps change your approach, change your practice, or maybe it's not change so much as emphasize or value, take action in a new way based on what I'm sharing with you here today. Okay, and collaborative partnerships. So this is the last value on the value wheel. And I think this is the one that we lean into so often. As Associate Chief of Nursing Practice, my department is called the Collaborative for Professional Practice. So I like to remind people that collaboration is in the title. So it's obviously a value of ours. It obviously influences the actions that we take as a team when we put a word like collaborative right on the title of our department. And the nature of healthcare is collaborative. All of the players, clinicians, leaders, we have managers on the call, we have nurse practitioners, we have nurses, we have social workers, we have rehab professionals, we have directors, we have policy analysts, we have students on the call. All of us as players will bring our own experience, knowledge, and competence to the relationships that we hold in partnership with other people to work within the system. As leaders, we know collaboration requires non-judgment. It requires openness. It requires willingness. Man, it requires caffeination. I feel like a lot of the time when I have to bring my most non-judgmental self, my most open self, my most willing self, I have to also remember that I am feeling my most well on those days, and that is required also from all of the other people on my team. So you can see how if I value collaborative partnerships, I also have to value health and healing. If I value health and healing, I probably also value uniqueness, and so on and so forth. Okay, that's a lot of talking from me. I'm going to briefly pause. I'm going to ask if there's a value that anyone would like to return to or ask for clarifications or questions. Okay, I'm not seeing any hands or questions. So we're going to zero into the content. We've just gone over those 8 values. Let's clarify with an example. So I had said before, we're going to use a children's story. Why would I use a children's story? I just think that in this context, This particular children's story, and actually many others that I've read to my kids. Oh, thank you. Aggie, I see your question. I'm going to come back to it. Children's stories can provide us a good example of how the values of strength-based nursing and healthcare come together. Let's go back. Aggie, you've asked a question about advocacy within self-determination. Aggie, would you be willing to come on mic and just explain your question a little bit?
Hi, sure. It was, I think you had advocating and amplifying the voices of others at the end there. And so I just wanted to, I think advocacy is, advocacy for, advocacy with. I think it's a complex issue, and so I think within the context of self-determination, I think it's a word and an action that I think requires thoughtful consideration in terms of honoring, employing advocacy, but then still allowing for self-determination and being careful that we're not speaking for others.
Yeah, I think you've said it really, really well there. I think when it comes to advocating and amplifying, what we're thinking about is recognizing that our role is not to decide for others. Our role may be to smooth the path for the voice of other people to come to the table. Our voice may be to say, I'm not sure that we've heard the whole story from everybody who's affected by what we're talking about. Our voice may, our role is really to not even decide if those people should choose or not choose to, but our role is really about, again, in ensuring that the individual choice in a given matter might have limits, or might not be fully represented by the situation. I think advocacy as an action could be influenced by any of the things on the value wheel, and certainly probably is. I would not say that self-determination is the only value that is representative of the actions of advocacy. So actually, if you want to put advocacy in the middle, what might be good, Aggie, is to think about the ways that advocacy might show up if you were valuing systems thinking. How does advocacy show up if you're valuing uniqueness? What do your advocacy actions look like if you're thinking about goodness of fit or timing, for example? I hope that that helps. Aggie, did you have any further comments or questions?
I guess, I mean, I'll think about this further, but I think it's a lot about listening.
Yeah.
So if there's an issue that requires advocacy, I would say take the lead from those that are most impacted and are involved in the issue, and then kind of taking more of a supportive role and asking them how you can be helpful.
Yeah. And again, that's also about uniqueness, collaborative partnerships, creating multiple perspectives, right? So we're not just thinking about how we advocate doesn't necessarily happen just because we value self-determination. How we advocate might be the way that we advocate would be influenced by a host of values. And again, these are values. These are not necessarily directions for how to do that, right? Because what you value guides how you're going to show up. So when you value self-determination and you're showing up in advocacy, you can see how that that respect for choice and individuality would really come to the forefront versus advocacy. When you value systems thinking, your advocacy is potentially going to be motivated how you do that by that value. But again, it's very nuanced. It's hard to pull apart with advocacy, especially. It's hard to pull apart any one specific value and say, well, I'm just acting because of this value. Usually things are layered and nuanced and very much influenced by other people who are in our circle. That's a great question. And it's a great way of thinking about how complicated the work is, and how really invested we all are in doing things as well as possible and doing things right. And when there are complex things like advocacy, being grounded in our values can be really helpful and give us a lot of conviction about the choices that we're making in that space. Thanks for the question, Aggie. Okay, so I'm going to share, I'm going to stop sharing and then I'm going to reshare. We're going to very quickly watch this fun children's story that I've used many examples. If my colleagues from Sick Kids have ever heard me give a version of this talk before, my apologies, because you've definitely heard this before. All right, so here we go.
Little blue truck teaches a big important dump truck the value of a few friendly beeps and a group of helping hands. The Little Blue Truck, written by Alice Shirtle and illustrated by Jill McElmurray. Horn went beep, engine purred. Friendliest sounds you ever heard. Little Blue Truck came down the road. Beep, said Blue to a big green toad. Toad said croak and winked an eye, and Little Blue Truck went rolling by. Sheep said baa, cow said moo, oink said a piggy, beep said Blue, cluck said a chicken, and her chick said peep, maa said a goat, Blue said beep, said a horse, quack said a duck, beep said the friendly Little Blue Truck. Honk, yelled the dump truck, coming through. I've big important things to do. I haven't got time to pass the day with every duck along the way. Vroom, went the dump around a curve. He saw a puddle and he tried to swerve. Into the mud rolled a big fat truck, and his big important wheels got stuck. His heavy-duty dump truck tires were sunk down deep in muck and mire. Honk, cried the dump, and he sounded scared, but nobody heard or nobody cared. Into the mud, bump, 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 came the Little Blue Truck to help the dump. Little Blue pushed with all his might. Now Blue and the dump were both stuck tight. Help, 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 cried the Little Blue Truck. Beep, beep, beep. I'm stuck, I'm stuck. Everybody heard that beep, beep, beep. The cow came running with the pig and the sheep. Up at a gallop ran the big brown horse. Goat jumped over the fence, of course. The hen came flapping with the chick and the duck, and everybody pushed the Little Blue Truck. Head to head and rump to rump. They all pushed Blue, who pushed the dump. They couldn't quite budge that heavy load. Then who hopped up but the big green toad? All together, 1, 2, 3. One last push and the tricks were free. Thanks, little brother, said the dump to Blue. You helped me and they helped you. Now I see a lot depends on a helping hand from a few good friends. Beep, said Blue, who wants a ride? Everybody scrambles to jump inside. Oink, quack, baa. Moo, cluck, peep, neigh, croak, maa. Beep, beep, beep. You can give a few friendly beeps, like and...
Okay. So I would love it if you could think about the story, Little Blue Truck, he's going along, he's talking to everybody in the day. The big dump truck comes, beeps, blows past everybody, then gets stuck, asks for help. The blue truck comes to help, everybody else comes to help with the blue truck. And then we push the truck out of the way and everyone moves on their merry way. That's like the very condensed version of the story. And for those of you who recently joined the call, hi, my name is Erin. I would imagine that's a very unusual time to come in and join in on this talk, but I'm glad that you're here. I would love it if we could just spend a few minutes telling me in the chat, what were the deficits? What were the problems that you saw in the situation, in the scenario, in the story? Thanks, Heather. Heather said, not taking time for relationship building. Yep. Not taking time for relationship building. The dump truck didn't take, thanks, Anya. The dump truck didn't take the time to look at the uniqueness of the individuals around him. The big truck did not recognize the importance of acknowledging the community. Yeah, I like that, Bobby Joe. Thank you. Jennifer said the importance of connecting with others. Awesome. Okay. People can keep popping in the deficits, the problems that they saw. The big truck, Sonia, you're right. The big truck felt more important than the others. So this is when we come to our issue. The big truck thought, thank you, Olyenka. The big truck thought it could do it all by itself. So we found problems in the story. We've been able to find the problems. Now let's go ahead and think about what we actually might have seen going well in the story. Now to help us out, I'm going to just go back to our values wheel. If we want to think about systems thinking, leaders working within the whole to appreciate the many moving parts of the system. Where did we see the value of systems thinking happening in the story? We picked out some of the problems, but did we see any values coming to life in the story? Where did we see systems thinking? Everyone played their parts in helping the big truck. Thank you. Yeah, Alex has said she sees collaboration. Olyenka, thank you. Everyone plays their part. So the solution came from the system, the many parts of the system, and who actually helped everybody move out of the mud was a very small part of the system, the big green toad. The big green toad was the one bit of muscle with his little froggy muscles who helped to push everybody out. Bobby Joe has said the systems thinking was taking the time to acknowledge one another and the importance of acknowledging everyone as part of the system to say, hey, you have a part to play, you have a part to play, we belong to a system. There is a little bit of belonging there. Okay, what about uniqueness? Where did we see the value of uniqueness within the story? The most common value of uniqueness for me that stands out in the story happens in the very, very beginning. That little blue truck is rolling down and every animal has their own opportunity to make a unique sound that's specific to their animal noise. And, you know, that's also one of the things that kids really love about this book too, is obviously that everybody's got a distinctness that is, you know, very much a part of their unique personality. Anybody see anything else about uniqueness that jumps out in the story? Size, yeah, Bobby Joe, you're right. Size, everybody brought a unique size. The big dump truck, you know, obviously brought a very specific size. There's another blue truck. All the animals have different sizes and skills. Some of them fly, some of them run, some of them gallop. Great. Okay, so you're already very, very good at this. What about health and healing? You know, paying attention to the ways in the story, where did we see the value of health and healing? Where did we see the value of wellness, capacity, experience come to the table? There are no wrong answers. And if anyone wants to come off mic and come on camera, we can chat too. Mary, thanks, Mary. Capacity, they all came together as one to help heal. Yeah, that's right. There's also this way that we can kind of think about solving the issue at the end helped them achieve healing. Thanks, Alex. The qualities of the relationships were somewhat fluid. There were different relationships that the big dump truck had with everybody on the farm that we assume from the story when he says, coming through, I have big important things to do. The qualities of the relationships before we came across a problem really became apparent when the problem showed up, which is the truck got stuck. The health and healing, the value of health and healing was also about healing the relationship as much as it was about getting the truck out of the mud. Okay, in the interest of time, I'm going to skip through and let's talk about one more. Let's talk about timing, readiness, and learning. Where did you see the value of timing, readiness, and learning come to life in the story? Jennifer has said, yeah, timing and readiness when the animals came to the aid of the blue truck. But there's a change moment in the story, right? Bobby Joe said the timing, it was a bad time for the big truck to ask for help when he wasn't invested in the team. That's right. Alex has said they had to learn to work together. They had to learn to collaborate. At the beginning, the truck gets stuck, and he says, help, help, help. And the line is, nobody heard him or nobody cared. So there wasn't quite the readiness there to change their attitudes or to change their perspectives towards the truck. It wasn't until the little blue truck comes along and says, I'm prepared to help. The timing is fine for me. I'm ready to engage and work with you. And that role modeling from the truck helped to, enable the readiness of the rest of the team to work together and learn how to collaborate and get the truck out of the mud. Olyanka says, the frog helping the truck came at the right time when the big truck was ready to accept help. That's right. That's a very good observation, Olyanka. The truck at the beginning was like, just get out of my way. I'm not a part of this. I'm doing things on my own. And then afterwards got in trouble and said, help, 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 I'm stuck. The timing for those relationships had to be right for the truck to be open and ready to learn how to be a good collaborator, to learn how to accept help. This is great. All right. We could go on and on. There's quite a lot to unpack within that short little children's story. Thanks to everybody who's been in the chat. Let's talk a little bit about another example. And we're coming to the end of our time together today. So this is an example I've tried to cater to many of those of you who are on the call. We're going to talk about Jamie. Jamie's pronouns are they and them. Jamie is a manager in an ambulatory care area of an acute care hospital, and Jamie is leading a new initiative on measurement-based outcomes. On a weekly basis, Jamie networks with clinicians from across the province. The clinicians often have very differing viewpoints. Jamie recently spoke with a new social worker who was really concerned about the lack of patient advocates for their project. And Jamie has just been feeling more and more uncertain on how, as a manager, they can assist their team. Jamie is also very aware of how busy everyone seems to be. They organized a virtual meeting for collaboration, but unfortunately, attendance was low. I'm curious, where do you see anything resonating from this scenario with you? Resonate, doesn't resonate? So it says Jamie the charge nurse. It should say Jamie the manager. How would a deficit model see this situation that Jamie's got going on? I can go back to the scenario really quickly. What is going wrong in this scenario? Remember I asked you at the beginning of the children's story, what's going wrong in that children's story? Tell me, when you read this scenario, what do you see that's not working? People are busy. People are busy. Yes, hands up if you feel busy right now. People are too busy. Yes, I agree. I feel very busy on a day-to-day basis, for sure. That is something that feels like it is not really going very well in this scenario for Jamie. Lack of advocates. Thank you, Olyanka. There's a lack of advocates. We don't have enough of something. We're feeling lack in this scenario. What else do we see that's not working? Tina, not cohesive, poor timing and buy-in. Yeah, we have differing viewpoints. People aren't showing up for collaboration. We don't feel cohesive. Mary, engagement from the frontline staff. Yeah, we don't really even know what do the frontline staff need in this context. And it seems as though, you know, when we create space to kind of try to find out, people aren't coming. What else might be going wrong? Communication. Yeah, it sounds like Jamie is finding struggles with perhaps the communication with the provincial network. It seems like people have differing viewpoints. It's hard to know how well that communication is going. Is a meeting with the clinicians across the province too general? Yeah, that's a great point. Ontario is a huge province. People probably should have different viewpoints. That's not uncommon, is that regionality would affect somebody's point of view. Thanks, Bobby Joe. That's a great comment. Any more things, deficits, things that aren't working in this scenario for Jamie? Jamie has a real mountain to climb in terms of challenges. Uncertain of how to assist. Yeah, I like that you pointed out. Jamie, as a manager, as a leader, is feeling uncertainty. And when you're busy and you're uncertain, it's very, very easy to just continue doing all of the things that are demanding a lot of your time. Bobby Joe, I like your attitude, because you're already trying to find solutions to the problem. You're saying maybe we should start with a survey. Is there a real interest in the actual initiative? Yeah, or is there a real interest in collaboration because people didn't show up? Andrea, I'm not sure, maybe you meant interest in the initiative or interest in, maybe clarify, but you could be right. Okay, I'm going to go. Bobby Joe, you had said maybe we should, oh, in the initiative, thanks, Andrea. Before we go to solve these problems for Jamie, and that's something that I have to pay attention to all the time, is oftentimes in my role, I could say, what is going wrong? What is the problem I want to solve? And then I say, okay, what is the solution that fits with that problem? Before I do that, before we do that as a group, let's think about how we can see the situation from a strengths-based perspective. Before we build solutions, let's think about the values that we might be able to pull out from the situation that might enable us to see the deficits and the things that are going well on the same page. I want to really be clear. Somebody's asked me in another presentation I did of a similar topic, how do you avoid toxic positivity when it comes to strength-based framework? And the really important thing is that you acknowledge that there are a lot of hard things that are happening in the scenario. Moving from a strengths-based perspective is not about discounting everything that isn't going wrong. It's about saying, yes, we see this and we see this. We're going to use these two things together to come up with solutions to the issue. So what might be the strengths that we see in the scenario? The social worker is interested. They see value. Yes, definitely. The social worker is interested. I'm just going to flip to here. So we might see that as, goodness of fit. The social worker is a good fit for this new project and initiative. We might see that as timing and readiness, that the social worker is invested and that there's somebody that sees value. We might also say that's the value of multiple perspectives and creating meaning. Anya, you've said here, other clinicians feel empowered to share their differing viewpoints. I love that you've said that. Just because we have differing viewpoints doesn't mean that that's a negative. That might be about the value of uniqueness, understanding and emphasizing that everybody's going to come to the table with different perspectives. That might also be about self-determination, about respecting that everybody is going to make their own decisions within their own limits. In terms of what we have going on, and the fact that people are voicing those things is a really, really good sign. Bobby Joe has said Jamie meets with them weekly, so they are invested. Yes, that's great. She meets with this group weekly on a weekly basis. Having people show up to anything on a weekly basis is quite a significant feat. So I would say that's like the value of timing and readiness, collaborative partnerships. Okay, Olyanka has said, already there is some existing collaboration with the clinicians. Yes, that's right. If we want to think about some other things, I might say things like systems thinking. The network exists. Clinicians are showing up across the province on a weekly basis. So there's a system that's pretty well established. We can think about it from that perspective. When we think about things like the context for the patient advocates missing, that's information we didn't have before. And so we can seek out using the value of goodness of fit. Maybe we have to think about goodness of fit for those patients, patient advocates, and perhaps we could solve that problem, understanding that goodness of fit is really important and choosing what we want to do next based on goodness of fit. So you're able to do these two things. You're able to outline and analyze the things that might be deficit-based in a scenario. And then all I'm suggesting, if you take one thing away from this webinar, is to just telescope out and say, I understand everything that's going wrong. What are the things that are actually working for this situation? What are the strengths that I can see alongside the deficits? Sometimes a deficit has another side of the coin, which is a strength, right? And then it's about us to think about what we value in the situation to make the next decision. So I had said, let's think about deficits, let's think about strengths, and now let's think about solutions. So what are the values you would give to Jamie so that they can deploy those values in this situation to come up with solutions? Bobby Joe, I think you had said, start with a survey. If Jamie were to start with a survey, what would the value be that Jamie would be using to use the survey to solve this problem? And if you want to put in the chat some other solutions that you think Jamie can use, now that they've taken a look at the deficits, now that they've taken a look at the strengths, what are some of the solutions that you see that Jamie might want to pivot into? Bobby Joe has said, opening the floor to the audience, pulling possible solutions from them. Yeah, so that's about collaborative partnerships, co-creation of solutions. Oftentimes when we have a title like manager, we can sort of feel like the buck stops with the manager and it's up to the manager to single-handedly solve something or single-handedly come up with the solution to something. But we discount co-creation of opportunity to work things out together. Anya, you have said goodness of fit. Goodness of fit might be a value that Jamie wants to deploy in this situation for sure. Kathy, you've said with a survey, you can also deploy the value of timing and readiness. What is the best time? What is the best way to collaborate? Definitely get a little bit curious about what would matter to people most when it comes to coming together and collaborating. Bobby Joe, you've said, decide on priorities together, especially with everyone's different views. Yes, very good. Sometimes we have priorities that are sort of set in motion and they live in the background. If we bring those priorities to the forefront and we say, hey, let's talk about these priorities. What do we think of them? Do we all agree? And we can deploy the value of multiple perspectives and creating meaning. Tina, great to meet you.
Hi, I don't know how to put this in the chat, so it just might be easier. But I also think with Bobby Joe's perspective of like a survey, it's almost like a pause moment. And I'm wondering if that lends to health and healing, like this idea of because how I read into the scenario, because I've been here many times, where poor Jamie didn't consider one piece of the puzzle. And so the social worker came up to Jamie, this resonates with me, even though I don't work in acute care, and said, hey, you didn't consider these patient advocates. Like, we need these. I'm sure the social worker had a nicer tone, but, and I wonder if Bobby Joe's initial solution is a pause moment to acknowledge, you're right, I didn't. And so let's go back to that exploratory phase and include you all in it. So I see health and healing a little bit there in the pause moment that Bobby Joe suggested.
Sorry, there's just a quick announcement. I don't know if you didn't hear that, but thank you. There we go. I think that's fantastic. Thank you, Tina. That's wonderful. I appreciate you sharing that on mic. That's really, really great. Heather has said you have to be careful with surveys. Jamie would need to be aware of how many surveys had gone out and offering more casual coffee, maybe one-on-one meetings. Yep. In person or virtual as well, if someone would rather. So maybe the value Jamie's going to deploy is about goodness of fit of the solution. Is a survey sometimes works for some people, maybe it doesn't work for other people. And Jamie's going to maybe deploy a couple of other opportunities, informal and formal, so that they can understand what people need to be supported. Olyanka, you have said Jamie might benefit from buy-in through communication of the value of the initiative. Yeah, so Jamie could also take a step back and say, perhaps want to understand a little bit more the perspectives that people have on the initiative and the ways that the initiative can bring meaning to their work. Jamie doesn't have to give people that answer, but Jamie might want to create spaces where people can come to the table and learn more. So that's timing and readiness, while also assigning meaning to that content within their own work, so that you can have both willingness and knowledge, which will combine together usually to create good buy-in across the initiative, which is, I understand what this initiative is trying to do, and I'm willing to engage in change behaviors in order to benefit from the return that the change will bring to my practice. All right. Thanks everyone for your engagement and participation. This is great. I have a comment here. If you have more examples you'd like to share, Tina, you said you've been in this position before. Before we do that, I just want to review quickly and put this all together is remember that using this framework is about investing in you. It's about investing in the development of your own foundations and acknowledging, just like I put up on the slide at the very beginning, what are your strengths? If you were to give a talk and you were to use my slide template, what would you put about yourself forefront as your strengths and your opportunities to bring things of value to your teams and to your groups? What would you inventory for yourself as a leader? And what do you want to invest in so that you can make your strengths stronger over time? The values and the value wheel especially is there to guide you and your actions. It is there to give you, like Tina had said, that pause moment on an issue, to take stock of what's going on and what's happening. I guarantee you, in my experience, I've always been able to leverage at least 2, if not 3 values when I think like, oh my gosh, what am I going to do next? This is terrible. What am I going to do next? When I look at that values wheel, I feel my own leader intuition, my own strengths be activated so that I'm taking the next step with a value behind me that really helps me feel conviction about whatever we're going to do next. That's about me as my own uniqueness, but who you are as a leader will define how this uniquely comes to life in your personal practice. And I hope you make use of the tools in whatever way you find them to be of value with you. If you want to share them more with your teams, please let me know. I'm happy to come and meet with anybody who wants to learn more about this content. I have uniquely found it to be very transformative to my own practice. I'm going to stop there. We are absolutely at time. If there are questions, I'm happy to stay just for a few moments. And there is a poll popping up. Thank you, Alex. If you take a few minutes to complete the survey, it was really, really great to spend a bit of time with you today. Thanks, everyone. I hope you have a beautiful rest of your afternoon and a safe week.